interviewer.
Hi, good evening, everyone. My name is Michelle, and I'm a nurse working with the Well Earth Collaborative. Today, I have the lovely Dr. Riina Bray on today, and she's going to talk to us a little bit about the Well Earth Collaborative and what exactly is this organization, Dr. Bray?
Well, thanks, Michelle. You can call me Riina. What is the Well Earth Collaborative? Well, the Well Earth Collaborative is exactly what it is. It's a collaborative. It's a network of many people from all different walks of life coming together, collaborating, working together in order to make a change on this planet, make a change for the better, and to do it together harmoniously in such a way that everybody is a winner. Everybody comes out saying, yep, I did my part and I made a difference. And so WEC, the Well Earth Collaborative, otherwise known as WEC, has a space for everyone. We have memberships for community folks, for children, youth, for people who are unwell because of environmental stressors on their bodies, minds, souls. And this membership is a sort of growing body of WEC that brings together many different minds and disciplines. We have core members who actually are involved in providing care, comprehensive care to patients. We have affiliate members who are people looking after those who are unwell due to environmental stressors. These affiliate members don't understand environmental health very well, but they want us to help them out with their patients. And so basically it's on a referral-based system, and these affiliate members are educated about environmental health. The core members are already quite savvy and experts in their areas. The affiliate members are those holding the bag in the community who need some guidance. And then we have everyone else who, again, is coming together. And most importantly, it's grassroots driven. So it's not being driven by patients. It's not being driven by experts. It's being driven by everybody, you, me, the next door neighbors, children, the elderly, the infirm, anyone who has a voice, and even those who don't have a voice have the ability to be heard and express their views and come together to help join hands and make a difference for the health of this planet and for the health of one another.
So most people probably know you as an expert in environmental health with Women's College Hospital, and we know that you have a very busy practice at the hospital as well. How is this different from patients coming to you on a referral basis through Women's? How is this different, or how is it the same, or what are patients getting, or people, or the community, as you say?
Right, good question. So the Well Earth Collaborative was developed in order to be able to provide comprehensive care to patients as well who could not have any further care at Women's College Hospital. So at the end of the day, Human Health and the Environment, which is my private practice, was created many years ago to basically adopt patients who were left at their own devices, and with a hope and a prayer from their family doctors to continue management. And so we've been seeing patients up at Human Health and the Environment, which is part of the Well Earth Collaborative, and we've been building WEC so that it's not just assessment, diagnosis, but the management goes above and beyond what we would be able to do at Women's College Hospital. So it is a transdisciplinary, multidisciplinary kind of approach to wellness. It looks at the spiritual side of wellness. It looks at nature and, recommuning with nature on a daily basis. It looks at community interactions, overcoming loneliness, forming groups online and in person to help foster creative projects that will help people sort of come together to manifest a common vision and goal for the care of their themselves, their loved ones, their friends, their family, neighbors, and the planet, all the creatures on this planet, all the living plants, all the bodies of water, the air that we breathe. We're here to look after our planet and one another. That's our mission. That's our goal. That's our purpose. That's a vital calling for everyone now to come together. And so, when we look at patients and we see patients and talk to patients and treat patients, we can't do it in isolation. It cannot be done in isolation anymore. It has to be done in context of what's their environment, how is it impacting on them, how are they impacting on their environment? Do they really understand that, buying that piece of plastic, that bottle or whatever, actually has a huge environmental footprint that's coming back to bite them through their air, food, and water contamination, affecting their hormones, affecting their mental health, affecting everything. So our choices are vitally important to our health. What we decide to buy at the store, what we decide to eat, what we decide to do with our bodies. And unfortunately, media is a terrible thing because it brainwashes people to think that they need a lot more to be whole. And we actually do not need very much at all. We need clean water, we need clean air, we need clean food, and we need shelter and community. That's basically it. And of course, clothing. And gosh, there's lots of ways to get clothing without having to buy new stuff all the time. So it's just a whole revamp, and it's not as if the world doesn't know what's going on. A lot of people are moving forward. A lot of countries are moving light years faster than Canada. And so that's what WEC's about, is just trying to get us together so that we can actually be effective and turn this huge ship around before it crashes into the iceberg and sinks like the Titanic, basically.
So it really sounds like, education and prevention is really key here before patients become so ill and before they have to, come see someone like yourself at the environmental health clinic or human health and environment. We really want to be educating them so they're making the right choices. And I'm just wondering, how that also, do we think about children in this whole, scenario, and what can we do for children, and are they affected as much as adults, or is it more so with children?
Yeah. Well, children are incredibly front and center for WEC. Children are our future. Children are our legacy. Children are vulnerable. Children are innocent. And we have to look after them, and they need to be able to express their concerns and their fears, and especially in this day and age where it's just so precarious. And so in order to protect them, and that's our duty, is to protect them, we need to understand that their bodies and their minds and their spirits are much more delicate than ours are. And they need to be taken care of in what they eat and what they drink and what they breathe and what sort of things they use and play with. And it all starts even preconceptually with the couple. Both of them, man and woman, need to be detoxed for a full year before they try to conceive, because they're going to be carrying contaminants, whether it be pesticides or volatile organic compounds or persistent organic pollutants or what have you, in their ovaries and in their sperm. And so they need to be cleaned up before they conceive. And then the fetus is at high risk, especially from contaminants that affect the neurological development, the brain development, and the heart. Those are the two major systems that are affected quite seriously by contaminants. And there are windows of vulnerability. They're called windows of vulnerability that we have to be aware of and be very careful about. And so the pregnant woman needs to be very well taken care of and educated about her choices. And of course, the father also needs to know, because, whatever comes into the house, it's going to affect the fetus. Renovations during pregnancy, no thank you. Eating fish during pregnancy, no thank you. You can get your omega-3s, but you don't have to eat fish. Fish is highly contaminated now, for example. That's just one example. So there are many, many issues that we need to be able to relay over to couples, to parents, to pregnant women, with regards to protecting the child. When the child is born, again, they're highly vulnerable. Their skin is very thin. Their breathing rate is higher. The amount that they keep in their bodies relative to their body weight is much higher than in a human. So what we would be able to metabolize easier is very, very well to do so with the same amount of food. And they're eating like crazy because they're trying to build themselves, right? So very important that we think about what they're eating and make sure that it's organic. Now, there is an issue right there, is what if parents cannot afford organic food, or what if parents are living in a precarious financial situation? That is very important also. And WEC is very, very in tune with socioeconomically disadvantaged people, very much in tune with social justice issues, gender equality issues, issues on racism, and other psychosocial issues that come up that will prevent people from accessing proper resources in order to have a healthy life and to look after their children. So those issues are very important, and we do have connections and with legal bodies who will support families or individuals with children who need to be guided and protected and have the resources that they require, because it is criminal that any child should have to be exposed to something that may give them cancer later on in life, or may cause them to become chronically ill later on in life, or even get sick when they're very young because they were exposed to something in utero when they were in their mother's belly. It's absolutely unacceptable. It's criminal. It's unethical. It can't happen. And it's happening all the time. And so this kind of stuff has just got to stop. It's got to stop. And that's why WEC exists, because it's bringing together all the organizations that are sort of similar minded, and bring them together to become a unified voice and force that will change things and stop this horrific roller coaster ride that we're on, where people are getting sick, children are getting sick, brain tumors are going up in children because of wireless radiation, cell phones, and other things. The rates have just gone up astronomically. So I'm sorry, but there should be no child that gets cancer. That's just that's unacceptable. And we cannot continue to allow this to happen. And people like yourselves, grassroots, it sounds kind of cheesy, but it is absolutely the only way things are going to change, is if people come together and put their voices together, hold hands, and move forward in a very forceful, unified way. We can shut down industry. We can shut down the government. We can do whatever needs to be done. Together, we can do this. And so educating parents, families, guardians, loved ones around how to raise children, how to protect the children is critically important. And WEC is part of that. WEC is absolutely part of that, trying to coordinate groups to come together, because that's the only way it's going to affect any change. If people are working in silos, if groups are working in silos, they can do something significant from the silo, but it doesn't usually stay long enough. It's sort of a little blip, and then everything goes back to status quo. And that's why, in the last 20 years, we've gotten somewhere, but we've gotten somewhere slowly. We need to sort of hurry it up. We need to hurry it up and understand that there's a lot of people who feel the same way we do. We just got to get them going. And it's every single person, every single man, woman, and child needs to have a voice. And believe it or not, we're all saying the same thing. We just need to be able to step up to the plate and express ourselves, have a platform where we sign petitions or put up whatever our opinions, or we interview people. Like, interviewing people is great. And then putting more people up on Twitch and, walking around around the neighborhood with a microphone and asking people what they think. And before you know it, you've interviewed 1,000 people that day, and they all said the same thing. Right. This is what I'm finding. Like, everybody knows what to do. They all say the same thing. They're not quite educated about the nitty gritty. That's really, really important. And that's what we need to do. But they all feel the same way. They all want the same thing. Yeah. And so this is like, it's going to happen. It's going to happen. And now we have
Dr. Val Mueller also joining us. Hi, Dr. Mueller.
Hi, sorry.
That's
have dog lessons on
no
Wednesdays.
problem at all. We were just talking to Dr. Bray about Twix, about the Well Earth Collaborative. She was just giving everybody sort of an overview of what the Well Earth Collaborative is. So we're just going to, I guess, wrap that up now. And I guess, Riina, it comes down to people coming together and really joining the Well Earth Collaborative so we can educate and reach more people and communities.
And bring ourselves together and just start holding hands and moving forward, because we can do this and we can do it fast. So thanks for interviewing me, Michelle, today, and looking forward to more of these. Thanks.
Thank you so much.